Thank you very much, Mr. Links. And just a brief overview of myself. I am a trained medical doctor with additional training in public health at the master's level and at the doctorate level. So I've been working in public health for over 20 years now. I've worked at the primary health level, primary healthcare level, as well as the national level, and I've been working with WHO for a number of years at the country office level. I've been working in WHO Namibia, particularly for about 6 years now. My initial role was in the area of child and adolescent health. And then there has been additional roles in health system strengthening and also in HIV and tuberculosis. These are all public health programs, and therefore, as a public health specialist or as a public health physician, they are within the areas that I'm able to cover. Currently, I am the infection prevention and control focal points for WHO in the national COVID response. So I work with the infection prevention and control pillar in terms of with the Ministry of Health and other partners who are supporting the national COVID response. So that is in brief who I am. So I've been
So when that thing was called, was sent there, the State House immediately said, no, we want
Okay. So in terms of, I would now go to just to talk briefly about WHO's role in the national COVID response. WHO is the lead agency when it comes to health, and it's the agency that has been mandated within the UN. It's the lead agency coordinating the UN's response to the COVID-19 pandemic in Namibia. In that regard, WHO has in place a team that is supporting the national team that is working very closely with all the pillars of the national response. So currently there are 9 pillars, and you can break them down up to 11 pillars of the national response. And WHO is working in each of these pillars to work. So they are working together with their national counterparts and also with other UN agencies. So as the UN, we are working together as a team to support the national COVID response. So there's a team working with the coordination, there's a team working with risk communication and community engagement, with points of entry, with the surveillance team, with the laboratory team, with case management, with infection prevention and control, with logistics, and also with essential services, continuing essential services, which is a more recent pillar that has come up within the national response. So WHO is working within these teams to strengthen the national response. And in the process, we are also engaging our regional and our headquarters support, garnering our regional and headquarters support in the process. So wherever technical assistance is required, we are able to link up with our regional team and those from our headquarters to be able to provide the necessary guidance for the response. And we are doing this together with the other UN agencies. So thank you, and over to you.
Thank you, Doctor, for that overview. I just want to ask: is everybody hearing us okay? Is the sound fine?
Yes, it's fine for me.
Okay, that's good. All right, so there's okay. All right. So in terms of how we'll do this, it will be the same as we did it last time. If you have a question, just put it into this, type it into the chat session, the chat space on the side of the screen here, and then I will go through them and as we go along. So there is at the moment nothing yet. and I think we get straight into it. There have been some questions that have been sent to us beforehand to look at. But before we go there, I'd like to ask Dr. Brantuo just to sort of give us an indication of where the World Health Organization, what is the sense at the World Health Organization Namibia office of where Namibia is at this point in time in terms of our response and what's busy happening in terms of the picking up of infections and so on, and where we are headed, if there's any indication or any inkling of that.
Okay, thank you very much for this. From the World Health Organization, in terms of planning, the World Health Organization has indicated the various stages that countries go through, and it indicates at the stage of no cases, the next stage in the spectrum is where there are sporadic cases, and the next stage in the spectrum is where there are sporadic cases. You have 1-2 cases. A lot of the times these may be imported cases, and then you find that some imported case may spread to someone. Someone may get it being a contact of an imported case. So you find that happening in the sporadic cases. And then you go to the next stage where we have cluster of cases. Yeah, cluster of cases, you have particular areas where cases are coming from. So you can link all the areas to a particular area. And then you go into the stage of community transmission. Currently in Namibia, we realize that in some places in the Erongo region, we have in Walvis Bay, some area where we think there may be community transmission currently, and we see the cases going up. We talk about community transmission where there's instances where people have COVID-19 and they cannot say particularly who the contact person they have been with. So once we get to that stage, we envisage that there could be some community transmission and people will be getting it without knowing exactly the contacts they have been with. Now in countries, we realize that because the countries they are not uniform. You have different geographical areas in countries and different things happening in countries. And for that reason, in countries, you can define different areas depending on what is happening. So we see in Erongo, for instance, where we have signs of community transmission. In the other areas of the country, we do not know specifically. We do not have evidence currently to say there is community transmission. So we know now the hotspot in Namibia, from our perspective, is Erongo. And for that reason, a lot of our support currently is focused on Erongo because that is where the hotspot is. We do recognize the fact that there may be community transmission or there may be spread in other areas. We are seeing some increasing cases, a number of increasing cases in Commerce region, for instance, and we are also seeing a few cases all over the country. The issue is that once we get these cases, it is important that we are able to, where we have sporadic cases. So you see that in some countries, we call they are sporadic cases because there are still very few cases and you cannot link them to a particular area. So where you have sporadic cases, it's important that there is contact tracing. You identify the cases promptly, you trace the contacts, you isolate these cases to make sure it doesn't spread further. So that is what is expected. So within Namibia, that is where we are now. That is what we consider from the World Health Organization's perspective, that we have a hotspot in Erongo where we think there may be community transmission. In the other areas, we are still seeing sporadic cases. However, there are some investigations that are going on that will give us an idea the extent to which the infection may have spread within the community. So that is basically where we are. Thank you, and over to you.
Okay, so I'll just take you through some of the questions that we already have. So the first question we received was, what is the World Health Organization view on the resumption of schools at a time when COVID-19 cases are on the rise?
Okay. Thank you very much. From the World Health Organization's perspective, from WHO's perspective, we usually provide guidance in terms of what countries should do, and the decision on reopening or resumption of schools is dependent on the country. The decision to open or close a school or reopen a school should be guided by the risk that the country considers. And it's important to also look at the risk and the benefits. So to maximize the educational and health benefit and balance the two to see what is the overall benefit of reopening or of closing schools. So in doing that, it's important to look at the students, at the teachers from the perspectives of the teachers, the staff, and the wider community, and also look at the potential of a possible outbreak of COVID in the country. So generally, currently, we do have cases, if you consider a place like Erongo region, where we talked about the fact that there's community transmission and it's a hotspot. We do know that based on the risk of transmission, considering the very high risk to the staff, to the students and the teachers and everyone, they decided to close the schools for a while. In some of the other regions, there are still sporadic cases. So we do know for some of the other regions, there have been some decision to reopen for some of the schools and for some of the classes. And the essence of such decisions, I presume, is the fact that they are looking at the risk and the benefits in terms of the fact that for some of the students, how does it affect learning and how does it affect other things? If you put education on hold for a while, will it affect some students reporting back to school? We do know that for some students, if they are away from school, they may not go back to school and they will not complete the school. And this would affect them in the long run. Also, in terms of places where you find things like school feeding programs, for some children, that is the only meal that is one of the reliable sources of food they have. And for that reason, it's important you may be important to look at the benefits and see how it's the benefits and the harms and see the balance. If there are overall benefits, you want to open the school. However, when you are doing this, it's important that you have in place the necessary measures and also to assess to see if the school has the necessary measures to ensure adequate physical distancing, it has the necessary hand hygiene facilities, it's able to have the staff to be able to make sure the children have adequate space to be able to play without coming into close contact. So looking at the school setting and things, such factors. So overall, from WHO's perspective, WHO provides guidance for countries to take action in terms of look to see what resources do you have. Are your resources adequate to make sure you are able to implement the guidance that is necessary in terms of ensuring your physical distancing, your hygiene, hand hygiene, and making sure that the children are able to practice, for instance, respiratory etiquette, they're able to have some facilities to, if they have coughs and colds, they're able to take the necessary measures. So all those things are important. And the way the schools have been reopened in the country, we see that it has been a staggered approach. So this staggered approach is helpful for the country in terms of the fact that it helps the country learn some lessons. It helps the country in school settings, for instance. It would help teachers and staff working in schools to deal with a few children at a time to see how well they are able to cope and add on. So I think from the WHO's perspective, and we do work with government in some of these areas, we realize that a lot of these factors that I've mentioned, looking at the risk and balancing the risk and the benefits, are being taken into into consideration as the schools are being closed. And we realize this is also an evolving pandemic. You can never tell how the pandemic would go. And we see good response that whenever there's some issue, when we see cases rising, there are measures that are taken to make sure schools are closed or reopened depending on the epidemiology, depending on how the cases are in the country. So we do see that those principles are being applied in the decisions to reopen or to close schools in the country. Thank you, and over to you.
Yeah, doctors. So there's a second question that we received was, could the excessive use of hand sanitizers pose potential health risks to people's skin, e.g. allergies, skin cancer, etc.?
Thank you very much. Before I answer the question, I probably should just talk about my own experience. That, you know, in this era, going to various shops, you are not sure exactly what is in the bottles and all that. So sometimes I keep on joking that sometimes my skin looks a little rough and all that. But I think the issue here is that with a lot of hand hygiene, we are using different products, and the issue is there are so many products out on the market, and it's really not clear what some of these products are. You realize that in different places they may be using some product or the other, and you are not sure exactly what the product is. So definitely you may find people with various allergies and all that, because we have a lot of products, and for some cases you are not even sure if it's a product you know, and you can indicate whether you are allergic or you are not allergic. Someone was talking about the fact that she was going to buy hand sanitizer, and someone was directing her to another place where they were selling other products. He said, well, if you don't find that, you can use this in lieu of hand sanitizer. And we find that some people may be using all kinds of products. So as you use all kinds of products, the risk of allergies and all that is high. So let's go to hand sanitizer, the proper products that we are supposed to use. When we talk about hand hygiene, we talk about water and soap, and we also talk about alcohol hand rub. Those are the recommended products for hand sanitation. So for alcohol skin rub, the alcohol skin rub does have the tendency to cause out dryness. And for that reason, WHO recommends in the preparation that as you prepare alcohol hand rub, it's important that you include some glycerin or glycerol or some skin conditioning agent, so that it would help in with the dryness that is associated with alcohol hand rub. So the alcohol hand rub has the tendency to cause dryness, but it's equally with hand washing. Frequent hand washing has the tendency to cause dryness. And for that, we do recommend that we need to add glycerin or glycerol or some skin conditioning agent so that it minimizes the dryness that is associated. The other thing is that for hand rubs or alcohol hand rubs, even though they can be tolerated, well tolerated by a lot, with once you have some glycerol in it, it may be well tolerated, but we find for some people, they may have allergies, because you realize for these products, you have some perfumes, you have some colorants in these products, and all those could potentially cause allergies to people. And for some, they may have, for some people who have general allergic reactions, they may have allergies with some of these products. For others, they also have what we call contact dermatitis, where the product touches, they have an allergic reaction to where the product touches. And once you have that kind of thing, you realize you may have a very rough skin condition on your hands. So yes, those things are possible. In terms of skin cancer, that I have not come across evidence to indicate skin cancer. the evidence on the studies that have been done are talking more about allergies due to the contact of the product and some of the few allergies due to the scents and all that that are used in the product. So this is what we know. But in terms of guidance for the community out there, what we would say is that people need to be careful and circumspect when they are using these products. We need to make sure we go by the guidance. Soap and water is a very good mode of hand washing, and therefore when you are at home and in your, you can use that. When you are out, that's when you need hand sanitizers, and it's important that you have the proper hand sanitizer. I mentioned that some people who are working in some of the facilities who are selling the product, some people have indicated that in some instances, people have been directed to all kinds of products because they have alcohol in some of those products. So they think that once there's alcohol in it, you can use it for the hand rub. But some of those products may have other things beyond the alcohol. Some of them are cleaning agents for furniture, cleaning agents for windows and all kinds of things. And when you use those ones, then the risk of the allergies and the, because allergies and the dermatitis, all those things could be worse. So that is what I would say, that for allergies, definitely it's possible you have that. And with the dry, it may be enhanced with the dry skin. And people also should, I would recommend that they also use some skin hand cream and things like that to make sure their hands are well moisturized, because we keep on cleaning their hands to prevent the hands drying, because the hands drying would aggravate the allergic reaction that you have. Thank you.
All right, doctor. So the next question is there any risk that the continual wearing of masks may pose future respiratory complications due to limited oxygen?
Okay, thank you very much for that. There have been a lot of concerns about oxygen. Sorry about that, about the use of the mask. From WHO's perspective, there are some risk associated with the use of mask, or some harms, I'll say, associated with the use of mask. But generally, it depends on who is using the mask and how the mask is used. WHO has recommendations for the use of, on how the mask should be on the mask. There are recommendations on the number of layers, the fabric that should be used for the mask, the number of layers that should be included in the fabric, and then the type of fabric and how this mask should be worn and how this mask should be taken off and all that. So in terms of the fabric, one of the important conditions in the fabric is what we call the breathability of the fabric. And currently there's some guidance that has been developed by the National Standards Institution that gives guidance on the type of fabric that should be used, making sure that it's breathable. And so it's important that we use fabric that is breathable in terms of the mask. Generally, for people who have, there are some people who may have breathing difficulties, people, for instance, who may have asthma, and people may have some chronic respiratory conditions, like some chronic respiratory conditions where they have, generally their breathing is difficult. For such people, the risk of having challenges with breathing when they are wearing the mask could be high. So for such people, we need to look to see how the use of the mask for those particular people, the type of mask that would be appropriate for them, that facilitates their breathing so that they do not have breathing difficulties. For such, we may need to look to see what other possibilities, what other options are there for them if the mask, because of their inherent breathing difficulties. So in this case, it is not the mask that is causing the breathing difficulty, but the person already has breathing difficulty. So the mask actually makes their breathing difficulty worse because they already have breathing difficulties. So for such people, we need to see what options are available. And for some of these people, sometimes it's recommended that you may use a shield instead of a mask. For others also, people who, like for children, for instance, where you are not sure they can easily manipulate the mask or they can easily react. For such people, for children, and for people who are who have challenges with their mental faculties, so it's difficult for them to react quickly, for the elderly and people like that. There may be some difficulties with using the mask because if they have challenges with breathing, their reaction time will be slower. So for such people, we need to look at the mask they are using. And for such people, you may not use the mask because they may not be able to react if they're having challenges with breathing and things like that. But generally, for the general public, we do not find that the mask can lead to respiratory complications, future respiratory complications, that is due to the limited oxygen. If someone is using a mask that is not breathable, and some of the fabric may not be very breathable, then that person would be able to tell that this is something that is limiting that oxygen or is limiting the breathing, and that person is able to tell immediately. And it's not likely that this is going to cause some future respiratory conditions. No, we don't have any evidence to show that. Some of the challenges we have with the mask, for some, we do know that for some people it's causing some facial irritation because the mask is on their face for a long time. And for some, it can cause some like allergic reaction because some people may be allergic to the material of the mask. And then we've talked about the fact that for some people, they are using the mask and they use the mask to infect themselves because they are touching the front of the mask and it's causing infection. So those are some of the challenges that we have with the mask. And also where people may have some facial disfiguration because of surgery and things like that, the mask could also affect their ability to breathe. So these are special conditions where the mask affects people's ability to breathe, where they have pre-existing conditions in terms of their breathing. But in terms of the knowledge of the evidence as to future respiratory complications, we do not see that happening. We do not have the evidence to show that that is happening currently. The evidence we have is what I have presented in terms of the possibility of contaminating yourself, the possibility of allergic reaction, and then there's also the issue of the general discomfort of the mask. And I think from what we hear, from what people say, we realize that for most people, there's just general discomfort when using the mask. And for that reason, we do have other options that, where possible, if you do not have things to do out, you stay home. So those are things that we do recommend, that when you are out, you need to wear the mask, that we need to look to see the type of mask to make sure it's in accordance with the standards and the breathing is not a problem. The material is breathable and it's not a problem for people to breathe. I don't know if there are any follow-up questions to this issue that we have raised. Thank you, and over.
So, Doctor, there's a question there. Can't the ministry come up with a guide for the preferred mask to use, a sort of guideline for all designers?
Yes, there is actually a guideline that is by the National Standards Institute. So the National Standards Institute has issued a guideline, and we also have, I think there's a guidance for making homemade masks. So what's I am working with the infection prevention and control pillar, and for that reason, I know there's a guidance. what we need to do is to probably communicate this guidance some more, so that where people make these masks at home, they are able to follow. For where they are made on industrial basis, they are actually supposed to comply with the standards that have been set by the National Standards Institute. So the guidance is available for the National Standards Institute, but we need to communicate that for the home use of the homemade mask more. So the ministry does have this guidance. So we can pass this message on, the importance of getting this guidance out there so that people know exactly the type of mask they use. And those who have special conditions, we see how they can be catered for. Thank you.
Yeah, I just like to say that on the World Health Organization website, there actually is these graphics that point out how to make the masks and what sort of materials to use, and all sorts of graphics related to mask use and mask manufacture. So I think people should take the time to go and visit the World Health Organization COVID-19 web pages, because there's a lot of information there that could actually be very helpful and could be disseminated better to the general public. I think I'll just say at this point that if you have questions, please write them in the chat section, and then we'll address them as they appear. So I'll just go back to the list of questions that we have here. So question number 4 is, what medication is used to treat COVID-19 patients? Can it be used as an aid for prevention?
Okay, thank you for that question there. In terms of the treatment of COVID-19, it depends on the spectrum of disease that the individual has. In medicine, we talk about definitive treatment when we know for this particular infection, you can treat with this and with this particular medicine, and that infection, it's killing a particular bacteria. The medicine is going to kill that particular bacteria. Now we also have another aspect in our treatment where we call supportive treatment, where we talk about treating the person's symptoms. So if the person has a headache, we treat the headache. If the person has eye pain, we treat the eye pain. And if the person has a cough, we treat the cough. So most of the treatment currently in COVID-19 is what we call supportive treatment, so that we treat depending on what the person has. Now within COVID, there is a spectrum of disease. As many of you would know, we have some people who are asymptomatic. So you find that they test positive, but they have no symptoms whatsoever. So for such people, we don't provide any treatment for such people who have no symptoms. Now we find some people who have mild symptoms. So a lot of these mild symptoms, these are symptoms that are more like upper respiratory tract infection. So to break it down, these are like flu-like symptoms. So the person has a cough, the person has a sore throat, the person may have a headache, a running nose. Now for such people, these are mild symptoms, and typically for people like that, the treatment would be like you would treat a flu. You'd give the person, you'd recommend things like paracetamol, or what do you call that? Yes, paracetamol. It's the analgesic. You use the analgesic. Paracetamol is what the name we use in the country where I come from, but here now I think it's Paramol. Now I can't even remember the name in the shops, but it's an analgesic, a painkiller. The painkillers that we have for the regular flus, that is what we use. Antipyretics, if there's a person has a fever, we use those for the fever. And then we also recommend for such people that it's important to drink a lot, to eat properly for the mild cases. Now for the moderate cases, one of the conditions that people may have is a pneumonia. Pneumonia is when you have infection of your lung. And for such people, they have some difficulty in breathing, they are coughing, and they have pain when they breathe. For such people, what it has been found that in such circumstances, you may have some percentage, not too many, about 10% of those with COVID having a secondary infection. So the person had this virus, the person has a COVID-19, but then the person has another infection on the COVID-19. So superimposed on the COVID-19, there's a bacterial infection. And we do know that we have antibiotics for treating bacterial infections. So for such a person, if the doctor would assess the situation to think, is this a possibility of the person having a secondary infection? And then you give antibiotics. So that is it for treating those who have pneumonia. And then we also go to the next stage where people have severe pneumonia. For severe pneumonia, the infection in the lungs is quite bad. And for that reason, this person has to go into the hospital. And for such people, you give things like oxygen. And if you think that there's an infection, you treat the secondary infection. And then you also give the painkillers and things like that. So generally, that is how the treatment goes, and it goes across the spectrum. It goes from the mild case to the moderate case to the severe case, and you find some critical cases. Some critical cases you find where there's a lot of breathing difficulty, and for that reason, that person may need to be put on a ventilator. For some of them, for such cases, you also find that the system is, a lot of the organs are have been affected. And so you need some other treatments to help with the person who is having, the organs are under a lot of pressure. So those are the kinds of treatments that I'll say we have. So we don't have a definitive treatment for the COVID infection per se, but then we have we have supportive treatments for the different conditions that are in place. Now, I'd just like to touch briefly on the fact that there are various trials that are underway, and WHO, through what they call there's a trial, a huge trial, solidarity trial. There are various clinical trials that various countries are using. And they are looking at some of these. They are using different medicines, various antivirals and other medicines looking at the immune system. And all of these are still under trial. So as at now, we do not have any high quality evidence on any of these medicines that are being tried in various countries. And for all these medicines, we have seen some side effects. So what is happening now is that these medicines are being used, some of the medicines are being used under trial conditions, and we use the high quality trial, that is randomized control trials, where people do not know, you select them randomly, and then people may not even know who is taking what medicine. And once all this is, you get the results from all these trials, then we can come to a definite conclusion that this medicine actually is good for COVID. This medicine can treat COVID. So that is basically where we are. There is some medicine, it's a steroid, it's a medicine that we already have in the system that has been found to improve the outcomes in some of the particular conditions. And so for such, WHO has indicated that this medicine is still under trial, but there looks like there are some positive results. And this is a steroid called dexamethasone. So currently that is what we know about the medicines, but there is no definite medicine that is treating COVID currently. So thank you, and over back to you.
So doctor, there's a follow-up there. How far are we from getting a definite medicine for COVID-19? Please specify in months or years.
Okay. So in terms of how definite, I cannot specify the months or years. what we do know, for instance, is, with dexamethasone, the trial was started, and it was found that in some patients, critically ill patients, that those who were put on ventilators, it was found to reduce the deaths of those who were put on ventilators. So this is something that has been found. But we also know, for instance, in July, WHO also received recommendations from some of the trials that they need to discontinue some of the medicines. So these trials are ongoing. We do not know, for some of them, people indicate where they are in terms of, some studies may have indicated where they are in terms of seeing the benefits of it vis-a-vis the risk of these medicines. But in terms of the months or the years, I really cannot tell. I would need to follow up in terms of follow up to be able to find out how definite it is in terms of the months and the years, because this is a new vaccine, because some of them initially show some positive signs, and then later on you find that as you go further, there is some new evidence which shows that the medicine is has some side effects or has a higher risk in a particular group vis-a-vis another group. So in terms of months or years, it will be difficult to tell. But what I would like to say that there are several trials going on, and we do know that as we get data, countries are advised on where we are with these trials, so that countries can make the decision as to the use of these medicines. Also, various countries have been invited to participate in the trials, because for these trials, you need numbers. You should be able to bring together, ideally, for some of these trials, you should be able to get quite a large sample size. And what is happening now with these trials is that before, you would have a trial taking place in one country or the other, and all these trials were independent of each other. Currently, through the Solidarity trial, several trials in several countries have been brought together. So all the data from all these countries is coming together in one trial. So from what we understand, this has the potential of reducing the duration of the trial by up to about 80%. But in terms of the months and the specific months or years, I would say that we still need to find out some more and come back to you in terms of how many months or years. We know that a lot of these things are taking place, and we know probably within a year. That is what we expect. That is the expectation, but I cannot give you specifically in terms of months or years for a specific medication. It will depend on how many people are utilizing the medication and what the outcome is. And for some of the medications, you realize as you go on, you also decide that no, it's not being effective or it's causing harm, so you stop the trial. So all those are all factors we take into account before we're able to come up with a specific medicine for this. Thank you, and over to you.
All right, I'd just like to also point out that, I mean, you can get all this information once again on the World Health Organization's COVID-19 web pages. They've on the homepage, they've got this feature that takes you, that you can click where it takes you to a spreadsheet that points out where exactly trials are, in which phase they are, and for which vaccine or treatment or so forth. So you can actually go and monitor those where exactly treatments and vaccine development is at any stage, because this is also regularly updated. And they do provide this so that the public, the general public out there, can also be aware of what's busy happening. I'd just like to say that if you're watching this on Facebook Live, that you can post your comment or question with the video if you're watching it with a live stream, and then we'll try through to as we go on. So yeah, so I'm going to just the last question that we have that we received beforehand. So this is question number 5. Most deaths to date are said to be of persons with underlying diseases, illnesses, example, diabetes, heart disease, and general respiratory conditions. What can people with such chronic diseases or conditions do to protect themselves aside from the generally accepted practices of sanitizing, wearing masks, and social distancing?
Okay, thank you very much for that. So as you have rightly said, currently we know there are no vaccines that are available for both the general public and those at risk. So the principles that you have talked about sanitizing, the wearing of masks and social distancing, it's important for prevention for particularly those with underlying risk conditions. But in addition to that, WHO also recommends that we stay healthy at home. And there are some recommendations that are made in terms of how we can stay healthy. So generally, in terms of staying healthy, we look at things like physical activity. So it's important that in as much as people stay healthy, we do recognize that for a lot of people with underlying conditions, for instance, with cardiac conditions, with obesity and some of these hypertensive conditions, there's the need for, it's associated with also inactive lifestyle. So WHO is recommending not for only that group, but for all of us to have some, incorporate some physical activity in our lives. Even though we are staying at home, try to do some walking, whether it's in the house, try to do some exercise so that it can help, because it exercises and can help in addressing the some of these conditions like the high blood pressure. It can also help in managing weight and reduce the possibility of other cardiovascular diseases like strokes. And then also it's helpful in diseases such as diabetes. So one of the things that we recommend, that even though we are supposed to stay at home, it's important that as we stay at home, we do have exercise, we do some exercise. And then the next thing that we also recommend is healthy eating. Healthy eating, we do talk about a variety of foods, the need for us to look at, what do you call the things? To look at, minimize our sugar, to look to see what foods that we can eat in terms of looking at a wide range of foods, our vegetables, reduce our sugar, and also limit the foods, the fatty foods that would increase our weights and all that. So this healthy diet is important for all of us, whether we have the underlying conditions or not, but particularly with those with underlying conditions. We know that the healthy diet has the ability to strengthen people's immunity. And for that reason, even though it's not going to, it's not exactly going to prevent you getting COVID-19, it's going to build your immunity. In the case that you get COVID-19, you generally are stronger and the body is better able to fight and recover from any infection that you have. So the second point is that we need the healthy diet. And then WHO recommends like more portions of fruits and vegetables, and then less portions of the other components of the protein, of fats and the carbohydrates. So more of the fruits and vegetables at this point to help with our weight, to help with our immunity. The third thing is that for people who also smoke, it's also a good time to quit smoking. For those who smoke, who have underlying conditions, there's also additional risk of getting severe disease, a severe case because of the impairment with the lung function. So we would also recommend that if you have any of these underlying conditions, then this may be a good time to quit smoking, as this would help you to conserve whatever the health of your lungs. And if you have COVID-19, it's not going to be as severe as it would be. So these are some of the things that we can do to address, to help us to minimize the risk of getting severe disease if we have underlying conditions. And the principle is we stay healthy at home, as we have said. In addition to these general principles, we would also recommend that for people who have these underlying conditions, it's important that you continue your medication. So if you are hypertensive, you have your medication, it's important that you continue to take your medication. If you are diabetic, you have your medication. If you need to have your injections, you continue on in this process, and you monitor for some who are able to monitor their blood sugar themselves, who are able to monitor their blood pressure themselves, you continue to monitor it and follow the guidance you have been given. If you feel unwell, you need to call your physician, your general practitioner, so they can give you some care over the phone as to what you can do, so you continue to maintain your health as much as possible. So if there's a risk of you getting infected, it does not lead to very severe outcomes. So that is what we can comment on in terms of the prevention for those who have underlying health conditions.
Thank you, Doctor. I see there's nothing more from our participants. So I'd just like you to speak to the infodemic, which was the term the World Health Organization Director General coined, a phrase he used already in February this year to describe the flood of information, disinformation, hoaxes, conspiracy theories that have accompanied the COVID-19 pandemic to date, and it's just gotten worse over the last few months. Just recently, we had this, over the last 2 weeks, we had this episode with a group of doctors in the United States allied to the administration there, pushing hydroxychloroquine, for instance, as a cure, without presenting any evidence. And then we have these sorts of episodes, and this was probably the most prominent one to date because of the virality of social media, the element of virality that comes with social media. And we had one specific doctor who is from Africa, Dr. Stella Emmanuel, who gained prominence on social media platforms here, sort of making claims for which she didn't provide any evidence. And this is, just in my experience, is contributing to polluting the, not just the global health communication information space, but also locally. I mean, because these things go viral here in Namibia as well on Namibian social media platforms. So what is your take on what is busy happening in this space, and what effect is it having on health communication and information as we deal with this pandemic?
Thank you very much. In terms of this, the infodemic, as you talk about, you're right that it's now actually, sometimes it seems like even worse than the pandemic, because there's so much information and it's very difficult for people to tell what is true and what is untrue. We also have, I think, we have the benefit of the what do you call it, in ICT. We have the benefit of ICT technology, which helps to communicate a lot of information, but it does also help to communicate misinformation as well. Currently, what WHO has is WHO has the website, like you rightly pointed out. And WHO also had a WhatsApp number. I think I'll have to look for that WhatsApp number and share to you, where you could send a WhatsApp to that number to request for information, and you could get information sent to your phone. So WHO has things like that to help the general public. And on the website, there's all the information that is needed, all the information that is available on COVID, that individuals, whether you are a health person or not, it's readily accessible. So anyone can go onto that page, onto the WHO website to access the information. What we also do within the countries, WHO also supports the countries in their risk communication and the community engagement. And there are some principles for risk communication within the setting when there is an emergency, for instance. And some of those principles of risk communication involves how you communicate with the press. The fact that at country level, it's important that whatever is said comes from a coordinated source. So at country level here, we have the risk communication team that is utilizing the communication unit, I think that the communication platform every day at 10 o'clock in the morning and at 3 p.m. or 4 p.m. in the afternoons to communicate. And what this has done over the time is that this has generated some confidence in the general public that we are going to get messages on what is happening with the pandemic from this source. So everybody is attentive and listens to the source. So that is one of the good things that is happening, that we come up with a common source, a coordinated source, and that source becomes a reliable source where people can utilize. Also at country level, what the communications team is encouraged to do is also to pass out the correct messages. So it's being done sometimes through telephones, mobile networks, is being done through television and various communications. So the importance of communicating the right message. Where the right message is not there, then you have the flood of false messages or misinformation. And I also know that in the country, people also listen for some of, they are able to keep track of the common myths that are surrounding the pandemic, and they provide appropriate responses. So this is also done at the global level. So when you go to the WHO website, it talks about the myths that are around COVID, and then it debunks those particular myths. So those are some of the ways of engaging with the community through various means, through questions, because as you ask some of these questions, we do recognize that these are questions that people want to know, and you go and find out some more information and put out there so that people are able to get information to address them. So those are, we do recognize that is happening, that there's a lot of information out there. And for that reason, we need to be proactive to anticipate some of the questions, or when we hear some of these questions, we also respond through our various websites. And that is happening at the global level, and within country level. Countries are working with the ministries of health to make sure they are able to respond to some of those challenges that we have. I would also like to talk also briefly about the issue of evidence. In terms of WHO's guidance, there are strict processes in terms of WHO's guidance and in terms of evaluating of evidence. And I think that is probably a message that we need to put out there some more, that when we talk about evidence, so that the general people understand better what evidence we refer to. Because like you rightly said, some may talk about experience, professional experience, which may differ from the type of randomized controlled trials that we look for as WHO. So it's important in our education also to be able to educate people on what we mean by evidence and the hierarchy of evidence, because people can do things from their perspective and come up with a result. However, you find that when you bring together several experiences of people and put together, or when you regulate the circumstances, you find that things are not quite the same. So, and that is the essence of research and studies, to find what is happening. So we probably need to educate more of our general public on the importance of this. But I would say once we have adequate information going out, hopefully this should counter whatever misinformation there is. And for that reason, from WHO side, at our headquarters level, there are regular interactions with the press. Every other day or a few days, our Director General comes to give an update on the pandemic. At the regional office, there's something similar happening where our regional director gives an update on the numbers of cases, the number of deaths, and generally what is happening in terms of the progress of the pandemic. And at national level, this is also replicated by the Ministry of Health working together with other partners. So yes, there's a lot of misinformation out there, but it's also possible to counter it if there's a robust communication strategy that can come out to debunk some of the myths and then can be proactive in providing information so that people look to that, source as a reliable source of information. So thank you.
Thank you, Doctor. There's a question there. Somebody asked, is COVID-19 our new normal? Do you think COVID-19 will ever come to an end, considering that there is no vaccine? And I think the World Health Organization Director General has himself cautioned against hoping for a silver bullet, I think is the term he used just this week, that we shouldn't think that a vaccine will suddenly vanquish this virus and this disease, and that we can go back to the way things were. So what is your take on this?
Okay, thank you very much. Definitely, like this, we should look at this as the new normal. As you rightly said, this week there was a meeting at the WHO headquarters, and the issue that came up from this meeting was the fact that we should look at this in terms of the long term, that we still would have COVID with us for the long term, and we need to start looking at it as the new normal, so to speak. In that case, then we need to start looking to see what is the long-term approach? What long-term approach can we have to addressing COVID? And how can we bring some of these approaches into our new normal, make some of these approaches our new normal? So definitely, it's important that we recognize this, that it's not going to go overnight, it's going to be there for a while. Having said that, we do know that there are a number of studies that are underway for the vaccine, and there are also studies that are underway for the treatments. And for that reason, we are working towards coming up with solutions. However, in terms of the timelines, the timelines for the vaccines and for the medicines, they may be set more from the more from the theoretical basis. However, as you go on, depending on what the outcomes are, you may go forward or you may not go forward. So there's a lot that is happening. However, it will depend on what the outcomes are. So in terms of what we are asked to do is to gear ourselves for the long term, because we really do not know what the timelines are. Even though the studies are, we do have the studies, and they are being, all these things are being accelerated. we do not have clear indication. What countries are also being asked to do is countries are already looking to see how they can procure some of these medicines, some of these vaccines, and all of those. So there are several studies that are underway. I was just trying to find the actual numbers in terms of the studies. So I'm just still trying to find the numbers in terms of the studies. Like you rightly said, there are several studies that are underway and they have different timelines. And the expectation is that once any of these studies get to a certain point and they are found to be effective and the vaccine is approved for use, then it can be widely disseminated. However, at any of those stages, because until you go through all the stages in the clinical trial, you cannot be sure that this vaccine or this medicine would be suitable for use. The benefits will outweigh the harms. That is the essence of it. And for that reason, the research is ongoing, but you need to know the final outcome before you can make any decision. And for that reason, we do say that it's more for the long term. And what we recognize is that generally now countries are trying to organize their lives around this. How in the long term, since we have this for a long term, how can we make this our new normal in the way we interact, in the way we set up some of our facilities like the outdoor facilities, the public spaces, how we set up all those spaces needs to become the new normal because we are not sure when this vaccine will be available. So there's still a lot of work, but we still need to recognize that this may be the new normal and we need to start planning for this. How can we, as wherever we find ourselves, whatever sphere of life, we need to identify this as the new normal and see what measures we can take to plan for this long-term approach. But maybe just to add, do you think it will come to an end? I think it will come to an end. So even though we talk about the new normal, I think there is a lot of work being done. And when we talk about the solidarity, one of the benefits that this vaccine and this illness, the pandemic, has brought is the fact that several countries all over the world, several scientists are working together in some of these trials. So whereas before you may not have that much collaboration, now with this pandemic, there's a lot of collaboration, and definitely we believe that it will come to an end once there's a vaccine. Once there's a vaccine, you'll find that the disease may still be there, but then in terms of the numbers that we see now, we would not have that many numbers. So you see that for some of the illnesses that we had in the past, with time, the virulence of the illness of the virus also goes down, so that these diseases are not as severe. So we do know that it will come to an end because people are working towards it, but then we need to prepare for the long term. Thank you.
Thank you, Doctor. So there's a question there. Is there any reason why authorities don't mention locations from which COVID-19 emanates from, especially in Walvis Bay?
Yes. So this is really an issue of the surveillance system. I think the communication that is given at the communication center is to inform people what is happening in the country, and also for us to know that we are all at risk and we need to take the necessary measures. In terms of the locations where the cases are coming from, within the surveillance pillar, there's quite an intricate system to identify all the cases, to be able to tell where the cases are coming from, and to map out where these cases are. And actually that is what was done initially, and through the mapping of cases, they were able to identify where the initial cases came from and how the spread has taken place. So there is within the surveillance pillar, there's a lot of information that is being sought, and this information is being utilized for action. Generally, the principles about information is that you collect the information you need and you utilize it for action. For the public, I'm not sure the usefulness of the information in terms of the level of detail. So I think I do know that within the surveillance system, all the detail that you are alluding to is tracked, and that is what is utilized to guide the response. That is what is utilized to target where the testing is done. That is what is utilized for the contact tracing, is utilized to identify those who need to go into quarantine and those who need to be isolated. So all that information is available. However, we also need to recognize that for some of the information, in terms of the confidentiality, it's important that we also provide confidentiality for the clients, for the patients who are seen. And for that reason, we need to balance the issues of confidentiality vis-a-vis the issues of communication, so that there is a suitable balance in terms of how much do you communicate, because it's important to have information. People can protect themselves, but it's also important to limit the, to protect the confidentiality of clients who are seen who have COVID-19. So generally those are the principles that are being utilized, but the information is available and it's being utilized to address the response. Thank you.
Yeah, Doctor, just on that issue of confidentiality, we've now seen over the last few months, sort of intermittently, people on social media calling for, and even in the media calling for people to be, those who have tested positive, to be identified, that so that others who might have been in contact with them could know that this person has been identified as having been infected. And then, of course, the other side of the argument is there's the issue of confidentiality, which it doesn't just apply to COVID-19, but to general healthcare. So, I mean, could you just say something on this issue, just expand a bit more on the issue of confidentiality and patient rights and so forth?
Okay, thank you for that. So yes, in terms of the patient charter, one of the important aspects of the patient charter is confidentiality. And patients do have a right to confidentiality in terms of their discussions with the healthcare worker and all that. So confidentiality is important. In terms of the contact, here we talk about in terms of identifying the contacts people have. A lot of times it is the higher the risk. You look at the risk of exposure, and those who have a higher risk of exposure are those who have the closest contacts. So generally, the principle is that for the person, for the individual who is found to have COVID-19, this individual is able to tell where he or she has gone and is able to tell the close contacts. You know, currently we do have in a number of places where we go, in our offices, in the public places, the malls, and generally all over, we do have registers where people are supposed to indicate their contact details, their name and their contact details, in case someone happens to is found to have COVID-19 who was in that space at the time. Then you can reach out. So it's possible to achieve both objectives whilst maintaining confidentiality if we all put down our names and details in some of these registers as requested. If someone is found to have COVID-19, and we do believe that people are responsible and they would get back, as people are asked about their movement after they have been found to have COVID-19, they are going to indicate where they have been. And once they indicate it, if we are keeping the right registers, then people can easily be contacted, and they actually know that they have been in touch with, they may have some contact with someone who is COVID-19 in the same space, and then the risk will be assessed, and then you can determine whether such a person needs to go into quarantine or not. We do know that there are some tools, ICT tools and apps, I'll say some apps that some countries have used, but it's on a very small basis where different people are experimenting with different apps, where people register onto the app. And once you register on the app, where there is, so that the app is able to link different people who have registered. So if one of them tests positive, it's able to indicate how many people who are on this app who have come either within 1 meter or 2 meters or some distance from such a person. So countries are using different things. And in those processes, we still need to make sure that principles of confidentiality are kept. And we encourage individuals to be responsible, to indicate exactly where they have been so that they can, we know exactly who the potential contacts are. And I think for each of us, as we go into shops, sometimes we write our names, and sometimes you see all kinds of names. Sometimes people will write, God is good, all kinds of names. And sometimes the numbers are not even real numbers, but it's important that we utilize these mechanisms to make sure we leave some contact details so we can be contacted in case there's a risk of exposure to us. Then we can take the necessary action to that.
All right, so we're busy winding down now. I see there are no further questions there in our chat section. So I'd just like to ask you, Doctor, if there's any message or anything you'd like to communicate at this stage that you feel journalists and the general media need to be aware of, to just go ahead and state that.
Okay, thank you very much for this opportunity. This has been quite a very helpful time of engagement. Currently, there are a lot of questions out there, and we hope that as the media, you help us to address some of these questions. I would just speak on a few of these issues. I think one of them is the issue of the de-isolation policy that has come out and the guidance that WHO has come up with. There are a lot of questions, but we would like to say that the country is evolving this policy to make it operational so that people are comfortable to know that when people are de-isolated, it is because the evidence has shown that the risk of transmission is low and therefore they can go home. The other point I would like to make is the issue of burials. There has been also a lot of discussion and concern around the issue of burials, and I think the press it would be helpful for the press to also encourage the community, the general public, to work together with the Ministry of Health, the other government entities to address this. One of the things that our Director General has come up with is the fact that with this pandemic, no one can do it on his or her own. So there's no way the Ministry of Health, there's no way WHO can deal with this. It has to be a collective effort. And for that collective effort, it's important that we come together as the media, as the communities, as the health practitioners, the professionals, everybody comes together to see how we can address some of these concerns that we have and how we can work together to in this regard. So I would say that for some of these concerns, as they come up, for some, the rationale, the rationale that may be given may be depends on the condition. We always look, in WHO, we always talk about weighing the risk and the benefit. So as these issues come up, we do encourage the government to weigh the risk and the benefit. And therefore we do that, we do that together with them to weigh the risk and the benefits. And it's important to engage the community so that they come to understand the rationales for these policies and they are able to work together to make sure we address the pandemic. The final point I would like to make is the fact that I think that it's around the question that was asked, is this our new normal? We do realize that this has been going on since March, so about 5 months. Initially, we figured that it was going to be a couple of months and it continues. And there's generally fatigue amongst all of us. For those who have to go by the recommended actions and the guidance, there's some fatigue. For those who are working, there's fatigue. And now it's time to re-energize ourselves and to plan to see what can we do the next coming 6 months. So as we go longer, what can we do? And I think for the media, it's important to keep on communicating to people that the risk is still present. And it's important that we all take the necessary measures to prevent the disease spreading. So some people may decide that we do not want to wear masks because we are not comfortable in them. But it's important that we should be each other's keepers, because as we do that, we protect others. And as we protect others, as we minimize the number of cases, it actually also protects the healthcare system so that the healthcare system is better able to address the few cases that it has. Because if we have too many cases, then the healthcare system would be overwhelmed, and that is not suitable for any of us. So I would say that as we go out there as media practitioners, we would like you to communicate that we do recognize the fact that we have been going on in this mode for a while. There may tend to be fatigue, but then we need to encourage each other, support each other to continue to go by the recommended actions so that we are able to minimize the number of infections and we are able to respond to them effectively. So that is my message for the media practitioners. And also, I think the importance of trust, the media practitioners, between the media practitioners and the healthcare system, so that we have these kinds of engagements. We are able to explain the rationale to you for the various actions and the various recommendations. And together we are able to work towards this pandemic. Thank you very much, Mr. Links.
Thank you very much, Doctor, for making time today for us for this very important communication. It is very valuable, it is needed. And I think, as we go forward and Namibia, the figures as they are trending at the moment, the communication becomes even more critical. Yes, I'd like to thank you very much on behalf of everybody who was part of this. And I hope that you have a good weekend. And I would like to thank all of our participants for making time for us, all the journalists and media practitioners and the others who wanted to be part of this. Thank you. This recording will be available on the NMT's social media pages, YouTube, and also on the Facebook page, the Facebook Live video. And I hope it was, yes, and there's a comment there, great information. Thank you very much for the opportunity. Thank you very much, Doctor. And would you be available for comment to journalists if there's any additional information that they require on some of the things that you've said here?
Yes, we can always send updates of information that is required. In terms of engaging the media, we have our protocols, so we'll definitely need to go through our protocols to be able to engage the media, but we are happy and we are very much available to continue to work with the media to provide the necessary information. We recognize the role of the media in communicating this information out. So yes, we are available for follow-up. Thank you.
Thank you very much, Doctor. Dr. Brantuo, thank you very much. Have a good weekend.
Thank you very much, and I wish you a good weekend too. So I pray that we all support each other and we continue to have hope. There's always hope at the end. Have a good weekend. Thank you.
Thank you.